One of the most important factors in achieving success in endodontic therapy is performing proper irrigation protocol. Now, let's go over what irrigation is. Per definition, is to wash out a body cavity or wound with water or medicated fluid. The goals of irrigation is to remove any bacteria inside the root canal system, to flush out debris, lubricate the canal during instrumentation, dissolve organic and inorganic material, remove the smear layer, which I'll get into in a little bit, and also disrupt biofilms that cause the infection of the teeth, getting root canal therapy done. The irrigations that I personally use, and again, there are many different types of companies that make different types of irrigations, but what works for me is sodium hypochlorite, which is the gold standard of irrigation that we use, as well as Q-Mix, which is a combination of EDTA and chlorhexidine. I'll first go over sodium hypochlorite. They have different percentages in the bottles that you may buy. I get from Edge Endo, and it dissolves organic tissue, could be pulp, bacteria, and also if you use it improperly, meaning if you extrude it out of the apex by accident, you can cause a sodium hypochlorite accident, which is something that you really don't want to do to the patient. So you want to do proper instrumentation and proper irrigation while using sodium hypochlorite. One of the best things about it is that it has a high antimicrobial action. It removes necrotic tissue really well, and especially we want to use it with patients that have necrotic tissue and big infections in them. You should use it for every case in general, whether it's a symptomatic irreversible pulpitis or a diagnosis of necrotic case. Q-Mix, which is the EDTA and chlorhexidine combination, removes the smear layer and eliminates residual bacteria. So it's a combination. EDTA is a chelating agent that removes the smear layer, and chlorhexidine is an antimicrobial agent that removes bacteria as well.